3. A 23-year-old man is brought to the emergency department by paramedics following a motor vehicle accident. Okay, so he was an unrestrained passenger in the front seat. Several days after hospitalization, his fluid volume and plasma osmolarity are measured and illustrated in the image below: solid line, normal line, dotted line, patient. Okay, so there's it. Okay, let's see. So here is the osmolarity going upward, and the fluid volume arrow is in the left and the extracellular fluid in the right. So we can see that this blue area has risen above, and the right and left portion has just decreased. Okay, so in here the intracellular fluid volume has decreased here, but the concentration, the osmolarity, has increased. The same case goes for the extracellular fluid. The osmolarity has increased, but the ECA volume has decreased. So which of the following conditions is most likely to cause the findings shown in the image? So the answer should be diabetes insipidus. So let's see why it is the answer. The figure shows the volume of the intracellular ICF and extracellular ECF fluid compartments, x-axis, and the osmolarity of the fluid compartment on the y-axis. We have already seen that. So the patient's recent head trauma is consistent with central diabetes insipidus due to the hypothalamic or pituitary damage. So in case of motor vehicle collision, if there is any head trauma, then we are going to see that there is a chance of getting central diabetes insipidus, cause sometimes for head trauma the hypothalamic or pituitary damage can occur. So the resulting decrease in vasopressin secretion leads to excessive free water excretion by the kidneys. Okay, so as the pituitary or hypothalamus is damaged, the vasopressin secretion is going to decrease. So as a result, the free water excretion is also going to increase, causing hyperosmotic volume contraction. We know this, right? Because in case of ADH, we know that pituitary or hypothalamus is going to stimulate ADH, and ADH going to have water excretion. So in this case, as a result, as this one is damaged, pituitary or hypothalamus, so the ADH is also going to get decreased, and as a result there will be excessive free water loss, right? It's excessive free water excretion. So as the water is going to get excreted, so the osmolarity is going to increase. So that's why it is hyperosmotic volume contraction. The volume is contracted because the water is excreted. So this condition occurs when the loss of free water exceeds the loss of electrolytes, resulting in increased osmolarity. Okay, so contracted volume in both ICF and ECF compartments. Hyperosmotic volume contraction can occur in the setting of diabetes insipidus, decrease in fluid intake, dehydration, and with the profuse sweating due to hypotonic nature of the sweat. So the hyperosmotic volume contraction can also occur diabetes insipidus in case of, and also can occur in the case of dehydration, also profuse sweating. So these are the basic physiologic conditions. So that's what has happened. So educational objective: the volume contraction and the expansion can be divided into osmotic, hyposmotic, and hyperosmotic states. Hyperosmotic volume contraction is caused by a loss of free water with retention of free electrolytes. So when the hyperosmotic volume contraction, if loss of free water or retention of electrolytes, because for the retention of electrolytes, the osmolarity is going to increase. It can occur in patients with diabetes insipidus as a result of decreased fluid intake or excessive sweating. So in these three conditions, first of all, diabetes insipidus, which can happen for trauma, right? Head trauma. And also like decreased fluid intake, this is the number 2 case, and excessive sweating. Number 3 case, the water is going to get excreted excessively. So as a result, the osmolarity is going to get increased. So that's why we can see this type of volume contraction, like this hyperosmotic volume contraction, which is shown in this graph. Thank you.